guys, today I'm in a different hospital than my actual hospital. I'm gonna tell you why. It's very beautiful, luxurious, and unbelievably amazing. I'm gonna show you around and introduce you to one of my professors and favorite doctors. Okay, hello guys, I'm today with Dr. Baris. He's my professor since I was in Cyprus and now we're in Istanbul. Okay, introduce yourself.
Yeah, hi guys, I'm Dr. Baris Kaya. I'm an associate professor in obstetrics and gynecology. Now I'm working in Istanbul, in Btmnى Clinic, Istanbul. So we have two surgeries today and Dr. Jude, so she's gonna attend with me. We had an open hysterectomy and big myomas, more than 20 weeks in size of uterus. And in the afternoon, we're going to attend the laparoscopic endometrioma surgery. So I hope you're going to enjoy that.
Yes, I'll take as much footage as I can if he allows, of course. I'm really excited because it's going to be my first hysterectomy and my first endometriosis surgery. So we've heard about it during the lecture. He lectured us about metric and endometriosis. So can you tell us what is it exactly?
Yeah, endometriosis is the presence of endometrium cells, which is the lining of uterus, outside the endometrial line. What does it mean? It should be in the uterine cavity, but if the cells and the glands of the endometrium, exist in outside the endometrial cavity, it can be in the ovary, it can be in the pelvic spaces, it can be in the peritoneum, it can be in the bladder, all peritoneal surface, sometimes can be in the pericardium as well. And really it's a very big and very complicated disease, and the surgery is very challenging also, and the medication is also challenging. So we're gonna do our best for our patients.
Yeah, these patients usually suffer from chronic pelvic pain and infertility as well. So it's very important, like you're saving a life that can produce another life by this surgery. And how about the abdominal hysterectomy, like open abdominal hysterectomy? What's the difference between it and the laparoscopic one?
Actually,
why aren't you choosing to do the laparoscopy instead?
Yeah, we in the contemporary gynecologic practice, we are using laparoscopy and also robotic surgery in our daily practice. And now in this clinic, we are doing laparoscopic surgeries, maybe more than 90% cases. But in this case, this is a very big uterus that we cannot maybe take it out easily. And also we have to make the deal with the patient as well. It's not only our aim. We have to discuss and talk, and sometimes they prefer open surgeries. It's not our priority. We always prefer laparoscopic surgery.
Minimal
invasive gynecology it's called. But sometimes, we choose this kind of open and traditional surgeries, not to forget it, right?
Yeah, it's exciting for surgeons, but it's usually like the patients afterwards will suffer from pain.
Pain a lot, yeah, unfortunately.
Now we have to get ready, wear our scrubs, and we will see you in the operation room.
Yeah. See you guys. Hi guys, now we are washing our hands, but let me show a trick. Before I'm going to enter the surgery, usually I'm washing my hands and then I'm washing my eyeglasses as well. So it gives me a clear vision, I feel comfortable, you cannot see every detail, but this way I feel really nice. Now my eyeglasses are more clear than my eyes.
operation. How was it?
Yeah, it was a difficult one, as we expected, because this patient had, I think, 3 previous C-section, and there were densely intra-abdominal adhesions exist between the bladder was attached to the lower segment of the uterus, and also the mentum was attached to the anterior abdominal wall. We released them, and then we were able to complete the surgery. And the obesity is really made the surgical procedures difficult. And the bowels, but you know, it was a good surgery. I think I enjoyed it a lot.
It was. There was an information that I didn't know, like when you showed me the myoma and he made me palpate them, and they were hard. I expected them to be benign and like soft, but actually he told me that if they were soft, we would suspect sarcoma.
Yeah, actually myomas and fibroids are usually firm, and they're not soft, but adenomyosis and uterine sarcomas, they're really soft. And this patient was 47 years old, and there were multiple myomas, which make us more comfortable, because usually sarcomas are only one lesion, I mean that unilocular, one lesion in the uterus, so solitary lesions. That's why I don't expect this patient can be a sarcoma, but really the myomas are really dense and really firm.
So were they sent to pathology?
Sure. We didn't use the frozen section, since the frozen evaluations are not very successful in the differentiation of uterine myomas and sarcomas. That's why we have to plan our surgery before the surgery. So if we have a suspicion of sarcoma, then we have to do in that direction. And this patient, we don't have any suspicion of sarcoma.
And one more thing, like you did not resect the ovaries. And why is that?
Because this patient was not in that age, and despite she was 46 or 47 years old, she's very close to menopause, but in ovaries there are some other hormones that exist apart from the estrogen and other ones, and testosterone also, and we live it in a natural way. So that's why. But if she was, more than 50 and 55, yes, we can remove.
So just to keep the hormone balance in her body.
Yeah, and the one more thing is important. We removed the fallopian tubes. As we talked and discussed during surgery, it's recommended to remove these bilateral fallopian tubes in order to reduce the risk of ovarian cancer. And this surgery also reduces the risk of ovarian cancer despite we leave the ovaries, because we observed them. They were looking healthy. There wasn't any cyst or another problem. And additionally, we removed the bilateral salpinx. So now she has very low risk of ovarian cancer.
That's perfect. Okay, thank you, Hocam. And we will take a hospital tour. Where about that?
Sure, why not?
Okay.
Why not?
end of our day with Dr. Baris. I really enjoyed the day with him. It was amazing. Such a great experience. Hopefully I'll do it again. And yeah, can you tell us about the last patient we saw?
Yeah, after our first surgery, we evaluated another patient who has a pelvic mass, a big mass, around 17 centimeter in diameter. So we evaluated her MRI and tomography results, and we are planning to do her an open surgery in this week again. And I hope Jude's gonna join with me. We had another patient with a big pelvic mass, so we evaluated, is it arising from the uterus or is it arising from the ovary? So it
Wasn't that clear?
Yeah, it's not very clear yet, but I think it's arising from the uterus. It's looking like that. And in any case, we're gonna have an open surgery, this patient. Since we are, very interested in laparoscopic surgery and laparoscopic oncology procedures in this institution, but in some cases, especially in the ovarian cancer and very big masses, we need to use the open surgery with the traditional surgery as well. So let us see what's happening.
Hopefully. So yes, okay, I'm gonna tell you one last thing. First, thank you so much for having me today. And so, can you say something in Arabic?
MashaAllah.
MashaAllah. No, I'm gonna tell you. We're gonna say don't forget to like and subscribe, but in Arabic. Okay?
That's good.
Okay. لا تنسوا. Say it.
لا تنسوا
تعملوا like
تعملوا لايك
وتشتركوا
تشتركوا
بالقناة.
بالقناة.
Yes.
Okay?
Yes, it's okay.
Yeah.
It's quick.
Jude was very helpful today, and she was very interested in the surgery, and she was skillful.
Yeah, I did something.
Yeah,
You let me
she had
scrub
to-
in.
Yeah, very nice. And really, I feel very happy when I see this huge interest to the surgery and to the medicine. So I really expect to see this kind of successful persons in medicine